Okay. Mm-hmm.
All right, we're live. So thank you for the people in the class and also for people online here. My name is Dr. Michael Prioux, chiropractic nutritionist down in Port Arthur, Texas, and we'll be talking about the omega 3-to-6 ratio. And so, part of our little better living series. Let's get right into it. It's only about 10 slides long, so this is kind of short and to the point, but it's going to make the point. So right off the bat, what is the omega 3-6 ratio? Just real quick, I'm going to say it's kind of like, the understanding of it is kind of like the vitamin D levels. So you get your vitamin D levels checked. Oh my gosh, if vitamin D is low, you got to you take some vitamin D to bring it back up. Self-explanatory. And low vitamin D levels are in all kinds of stuff, especially all the brain degeneration things. Any of the bad diseases out there, you'll have that. This is kind of like that marker. So I've got to break it down for you a little bit of what it is and where it is and how it can affect you. But it's just the omega 3-6 ratio here. So basically, omega 6s are inflammatory fats, and we need that. If something happens in the body, if you damage something, you need inflammation to come there, take out the bad stuff, and then you need the anti-inflammatory stuff to come in there and lay down the good stuff, right? So we have to have that. We have to have inflammation on the omega 6 side and then the omega 3 side. It's kind of, I'm generalizing it way down, but basically you should have that ratio. And to go right to the point, that ratio is about 5 to 1. Right, that's what we need to have in the body. Okay. Now, just because we know that ratio should be 5 to 1, around 1900s, most of the population lived around the waterways, lived on the borders of the waterways in America, and so you ate a lot of fish. Fish is high in omega 3 content, and so our ratio back then, we kind of evolved. We kind of evolved on about a 1-to-1 ratio, right? 5 to 1 is about where our brains and bodies want to handle it. 1 to 1 is kind of what we were adapted to. But now, when they're checking stuff, that ratio is somewhere between 10 and 20. Now, I've seen higher, right? So they don't always have to be that high. But we want that ratio down to 5 to 1. So if your ratio is above that, hey, that's bad. We want to get that ratio down. And if it's lower than that, my goodness, what are you doing? You need to write a book, because in America, we just don't eat enough omega 3s. So. And why is that? Why has this changed so much? Well, a lot of people, they do not eat fish. Fish is an omega 3. I have a slide here in a second that's going to show like where the omega 3s come from, and we'll have a slide where it shows where that comes from. But a lot of times we're eating the wrong fatty acids. You've heard about trans fatty acids and cis fatty acids and all that stuff. So that stuff's bad, and then also just the stuff that we have in our diet. We're eating tons of toxic stuff and colors and flavors and foods and preservatives. So those things do that. So basically in America we have no problem. Remember, we need some omega 6s. We have no problem getting omega 6s. We get an abundance of omega 6s. We just don't hardly get any omega 3s. And so if you need them both and you get none of one, the ratio is going to be off. So that's pretty. Did I lose anybody on that one? Right? It's super easy to understand. But just nobody knows about it because we don't go around saying, hey, what's your omega 3 ratio? Like, what's an omega 3? Oh, it's a nutrient. Okay, what's your nutrient ratio? But we do sometimes when we get around our family, right? We say stuff like that. Hey, what's your cholesterol level? Hey, how's your hemoglobin A1C if you're diabetic, right? So there are some markers we do. Vitamin D is an easy one because it's a nutrient, but it's also it's almost like a hormone too. But anyway, that one people understand. But and you can check for it. You just check the box on your blood work. If it comes back low, you start taking it. There's pharmaceutical grade vitamin D and there's small stuff. Okay, so going back to omega 6s and 3s, I want to do a quick one. I mean, you can spend an hour just talking about the different ways they have. This is the omega 6 side, this is the omega 3 side. The omega 6s, like I said before, they are inflammatory, and they start, this main omega 6 up here that breaks down into all kinds of omega 6s, it's called LA. We're going to come back to that later too. So linoleic acid. That is the mother of all the omega 6s. And then it gets broken down. And where do you get omega 6s from? Pretty much everything we cook with, right? Corn oil, canola oil, safflower, peanut, soy, cotton, sunflower. Chicken also has omega 6s in there, right? I mean, chicken's good for you, but it just happens to be omega 6. Okay, so on the other side of that, where do we get the omega 3s at? Okay, if the omega 6s are inflammatory, well then the omega 3s are the anti-inflammatory. And they come, I mean, if you look at this, it's literally just one little letter off, right? So that's why we put there ALA, alpha linolenic acid, whereas this one's just linoleic acid. So you can't get your tongue tied around these things. Just know that's what we just try to say: omega-6s and omega-3s. And where do we get omega-3s from? Obviously fish, right? That's a big one we're going to talk about here. Flax seeds have omega-3s in them, and then hemp and walnut, right? And so when you think about that, you say, when's the last time you ate something cooked or fried or something around this stuff? And this stuff is good over here. Well, when's the last time you had chicken or beef or corn? We get that stuff pretty much every day. When's the last time you had fish? There's a lot of people that just don't like fish at all. When's the last time you had flax? Oh, I think I have a neck pillow made out of flax seeds, right? I can heat up and stuff like that. So it's around us. I've never eaten hemp. But walnuts are good. You can find walnuts, right? Especially this time of year. It's Christmas time. They'll have the mixed nuts and stuff, so that's good. But even though we have them, we don't eat walnuts every day, right? So then you start seeing, well, wait a second. If I can only get it from some of these areas, and I don't eat fish, I wonder what my level is. And that's what we're finding. And so the easiest way to take that is fish oil, right? It's easy. That's kind of a joke. It's easy to squeeze a fish and get some oil out of it, right? That's not expensive. But then once that oil's there, a lot of times the deep water fish, they have some mercury and they have some contaminants in them. You've got to molecularly distill out the good stuff and leave the bad stuff behind. So that process makes it a little bit more expensive. So just because fish oil is cheap does not mean it's bad. Just because it's expensive that doesn't mean it's good. You got to look at how it's made and where it comes from. Okay, so like we said, fish oil is one of the omega-3s, anti-inflammatory, and then the biggies that are inside fish oil are these two things right here, EPA and DHA. I was going to put them up there, but I can't pronounce it, right? Pentatoic acid and some of the other ones here. Big $10 words, not even $5 words here. And that's what it has, EPA and DHA, right? A little fun fact is that kids need more DHA than EPA. And so the brain is 40% DHA of the membranes, but the kids can convert DHA over to EPA. Adults can kind of go back and forth, but the kids can't go from this side to this side. And so a lot of prenatal vitamins, on the last class we did, we were talking about that. Some of the ladies have kids, their prenatals come with it, or they take the DHA on the side. That's one of the things, the kids' chewables, right? The DHA. Have you heard about those before? Haven't heard about that? Okay, that's one of them. But like I said, this has been maybe the last 5-10 years. So the old stuff I grew up with, never heard about DHA, but that is some of the stuff. So it's kind of a brief looking down of fish oil. And then what is this tied into, right? I'm hiding my slide here for a second. Well, pain, brain, and heart. So step one, just like we talked about, if you get omega-6s are pro-inflammatory, omega-3s are anti-inflammatory, and you have way too many omega-6s, and they're pro-inflammatory, could there possibly be some pain? Yeah, why not, right? Of course there is. There's a little study down here, you may not be able to see it online, Molecular Neurobiology, January 2011. They had a cool study here. We're going to get some of the stuff they did. They looked at a lot of things linked in with omega-3s. This right here, N6, N is the term for omega, so that means omega-6 as well as anything else. So, but in their study, they came out and said that diets with a high ratio of 3-6 may enhance risk of depression and inflammatory disease. Well, of course, because you have way too many omega-6s. This was my little thing I just told you. If omega-6s are way too high and you're not getting the omega-3s, can you be imbalanced and have some pain? Well, of course. And then their study, back to their study again, inflammation alters the threshold of nociceptive afferent system. It's just the way your body perceives and recognizes pain. And we already know that. Billions are spent on pain drugs to counter the effects of too much omega-6 in the system, or just pain, right? I think two of the top 5 or 2 of the top 10 drugs, they're anti-inflammatories. Everybody's taking something like that, whether it's over the counter or prescription. So for those people, it's like, hey, what's your omega-6 levels? If you don't know that, it'd be something good to check. We're chiropractors, so a lot of people come to us because they're actually in pain. And it's one thing if it's just localized to one area, like a back or a neck or a shoulder or a knee or hip, you can work with that. But if it's everywhere, if it's the hip today and then the knee tomorrow and the whole body the next day, well, hang on, this is something you can think about here if you're always getting those things. And it's nutrition. So, oh man, I was looking for all the stuff around atrial fibrillation. I thought we were going to delve into that. And the research is kind of hit or miss on that. Some say yes, some say no. So I didn't put any of those up there. Not trying to mislead anybody. But these were pretty easy pretty easy to understand. So there's American Journal of Clinical Nutrition in 2000, and this one right here says New England Journal of Medicine in April of 2002. Kind of came up with the same findings. I think this one came out first, and this one kind of solidified it. So the omega-3 fatty acids found in fish are strongly associated with a reduced risk of sudden death among men without evidence of prior cardiovascular disease. That's kind of a good one, right? We're not even going to talk about atrial fib. So 30% of the cases, the first sign of heart disease is death, right? Somebody has that. Hey, they were fine, they went to the doctor, everything was good, and then 2 weeks later, died of a massive heart attack, a coronary. So that's 30% of the cases. So how can we stop some of that? Well, hey, omega-3 fatty acids found in fish oil are strongly associated with reduced risk of sudden death. So that doesn't mean they cause it, they can cure it, but it's just one of those health marks, kind of like vitamin D. If vitamin D is low, it's bad. You want to bring it up into a healthy range. So this is something we want to take a look at, bring it up in a healthy range. So when I looked at a couple of these studies, that's kind of self-explanatory there. If you can reduce the risk of sudden death in somebody who's never had heart disease, that'd be something we want to look at as well. And then we've got a couple of slides here for the good old brain. Oh man. Michael Schmidt wrote a book called Brain Building Nutrition. He's a PhD guy. And this is his question up here. The brain we have in our head is made up of 60% fat. And so his question is, can it go rancid? Right? That's a good question. Well, what kind of fats do we put if our body's always rebuilding, taking cells in and out and repairing? If you have the wrong kind of fats coming in, can it go rancid? So good question. Back to the fish oil, we talked about there's 2 things in that called EPA and DHA. 40% of the makeup of the actual structure of the brain, 40% of that is DHA. Hey, that's a lot. And if you're low in DHA and EPA, right, so bad things can happen. I want to put something in here too. More than 3 million TBIs, traumatic brain injury, 3 million of those annually, and auto accidents are the primary cause. I know we don't do a lot of auto accidents here, treating for that, but the number 1 sport for concussions and traumatic brain injury would be football. I think everybody knows that. Anybody? I know Amanda knows, but anybody know what number 2 is? Second leading cause of sports injuries, sports concussions, CTE, chronic traumatic encephalopathy. Girls, soccer. I know you're thinking, it'd be hockey, right? Where they're slamming into it. There's plenty of concussions and stuff in there, but football and then girls soccer, they're taking the headers and stuff like that. So it's great. It's just one of those things that it's stuff you wouldn't think about. So keeping up with the brain and keeping it, having its nutrition is kind of an important thing. David Perlmutter, this guy's wrote a couple of Better Brain book. He's wrote Grain Brains, wrote a couple of different things here. He says that the same forces that age the body also age the brain, but they only did it faster and harder. So we got to make sure we do that. The biggie that actually can break down the brain is free radicals. Free radicals destroy brain tissue by oxidation. We're going to come back to that too. So if you have these oils that oxidize the wrong way, you make free radicals and it starts making inflammation, right? Free radicals promote inflammation. We got to reduce that as well. And inflammation, it doesn't have to be just brain diseases, but inflammation is linked to nearly all chronic brain diseases, which is your bad ones: Parkinson's, Alzheimer's, MS, dementia. So if that's something that's in there, this might be a marker we want to check. How do we bring those inflammation levels down? And just as a general note, just away from the slides and stuff, if you're always in pain, you want to ask that question: where's the pain coming from? If I hit you in an ankle with a bat, the pain came from the end of this bat, and it's going to take a while to heal up. But if you're always in chronic pain, where is that pain coming from? Right? If no one's beating on you, what's going on? And sometimes you have the answer, sometimes you don't. But that's something you want to add. You want to get to the answer of that question, whether it's foods or health again. Dun, 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 dun. This is a study in Neurology in 2012. RBC, omega-3 fatty acid levels, and markers of accelerated brain aging. So that was the little study they called it. And so these are some of the things that came out of it. Red blood cells are the most accurate for membrane composition. And so when you're checking for the omega-3 ratio, a red blood cell inside the body lives for about 3 to 4 months. So that's what we say, about 120 days. And so as it dies, it's going to break everything down. Your body's going to make new red blood cells. It's that membrane is what we're talking about. So the red blood cell membrane, every cell in your body has that membrane around it. And that's what we're trying to get. That's where we want that 5-to-1 ratio. We want that in there. And so this study said, hey, if you check, it's easy to check red blood cells. It's better because you can take them, you can break apart that membrane and see what it's made of, as opposed to plasma levels. So they're saying come off the red blood cell itself, what's in the actual membrane of the red blood cell, not what's just floating around in the system. That would be called plasma. Plasma levels you can change with about 3 days worth of supplements, whereas these guys here, you can't really, you can change it over time, but you really want about a 4-month version of what's going on here. Basically, all it's saying is that the red blood cell membrane test is a better way to check your omega-3/6 levels. And then a couple of good little facts about that. Like we talked about earlier, if 40% of your brain membrane is DHA, and if you're low in DHA, lower DHA levels are associated with smaller brain volume. Well, yeah, because that's 40% of it is DHA. Omega-3 influences membrane function and the activities of membrane-bound proteins. When you have that, when you think back to 7th grade, right, teacher would draw a big circle. Here's the cell membrane, and inside the cell membrane we have a nucleus, and then we have some mitochondria, sarcoplasmic reticulum, right, lysosomes. You got all these little things running around in there, the DNA and stuff. But that membrane portion, that when they draw the circle around there, it's not just a circle, it's a bilipid phospholayer membrane, and they have tons of, we call them little TV antennas sticking off the top of this thing. I think one muscle cell has 10,000 receptors just for thyroid hormones. I mean, so you probably couldn't see the covering. If you were that small, you couldn't see the cell because there's so many little antennae on top of it. Okay, so there is a ton of stuff like that. Maybe not so much for the red blood cells, but for the other parts in our bodies too. And then what they're saying is the omega-3s, because that's what happens there, that makes up part of that membrane. It influences what can stick on there and how things, it's almost like tinker toys. It's organic chemistry at its finest, of how things are lined up and what lets things in and outside of the cell. And so omega-3s can greatly influence the membrane function. And last one here, lower levels of EPA and DHA, which are things inside fish oil, and late middle age were associated with markers of accelerated structural and cognitive aging. Not a good thing, right? We don't want that. We want that to get better. And last little main slide here, back to that first study, molecular neurobiology back in 2011. They came out with a couple of different things here. They said, this is back in 2011, that remember we talked about that brain, you have membranes, every cell in the body has a cell membrane around it, but the ones in the brain that are made up of more DHA, their ratio is closer to 1.1. Remember we said we can check in the red blood cells, we want it closer to 5 to 1. That's a generalized marker of overall health in the body. But in the brain, that ratio is more 1 to 1, omega-6s to 3s, and they said that should be the human target. Man, that's a lot of fish. You probably have nosebleeds if you get down that low and stuff like that. But still, it's something to think about. This is off their study. And then back to that one slide we talked about the omega-6s. The mother of all the omega-6s is called linoleic acid, the LA. That's associated with shorter telomeres more than any other nutrient. Now, a telomere, think about the old DNA, right? You see it's a double helix, wraps around here. Chromosomes and stuff at the end of these things, you have little telomeres that stick off the end, and as those telomeres shorten, they shorten over with age. When they shorten, we age. We know that. So anything you do to stop those telomeres from shortening, or if you can grow them out, it's kind of hard to grow them out, but if they shorten abnormally, you will age faster. So we know that. And one of the, it says linoleic acid is associated with shorter telomeres than any other nutrient. Okay, so if that's the case, we don't want more of that floating around the system. We want to make sure it's balanced out the way it should be. Omega-3 fatty acids have positive effects in patients with dementia, schizophrenia, depression, and other central nervous system diseases. It has to do with the way that the DHA is more the actual membrane of the cell, and the EPA has a little bit to do with more of the signaling of kind of how things get in and out. So super cool. They have some cool little studies on that, and I don't want to get all high into the weeds because you got to almost see the membrane in front of you and know what we're talking about here. But that's just it. Omega-3s have a positive effects on dementia, schizophrenia, and depressions. The mood stuff. Last couple here, omega-3 can affect not only cognitive function, which is how you think and how your brain works, but also mood and emotional states, and may act as a mood stabilizer. So those two kind of go together. And so this was a cool little fact. They also looked at a daily dose of 3 grams of omega-3s for 3 months. So 3 grams for 3 months significantly decreased feelings of anger, anxiety, and aggression. neat little thing here. This is all from 2011. So there was other studies in there. Like I said, we don't want to get high in the weeds. Basically, that's what we're trying to say is this ratio is that doesn't cause stuff. We just know it's associated with some of the bad things. So this may be one of the markers you check with your health, just like vitamin D and glucose and everything else. So what can you write? Step one, check your levels. Check your levels with your doc. I know we do it in this office. It's just a little finger prick. You bleed on a little thing, and they go look and see what those red blood cells are made of. And if it's out of range, get it into range with some fish oil. When do you retest? We say maybe 3 to 4 months. Remember that red blood cell losing red blood cell in the body lives for about 120 days. So you don't need to test it every week. Just give it 3 or 4 months, then recheck it. If it's still low, keep going. If you're not getting any traction, we got to figure out why you're not absorbing it. But that's not really a big deal here. Other things you can do is exercise. Getting blood and oxygen inside and outside the cells is always a good thing. Get the good stuff in, get the bad stuff out. Give it a little time. I shouldn't have to say this, but don't smoke. That is you're making free radicals. Smoking makes a free radical factory, and free radicals will help things oxidize and cause a little more inflammation. We don't want that. We already have enough of that going on without smoking. Decrease chronic sugar consumption. Now I'm saying that right in between Thanksgiving and Christmas. So there's going to be some sugar consumption going on in America, right? But what they found out is chronic, excuse me. Oh, I'm telling you to decrease sugar. If you have a higher sugar intake with a low level of omega-3s, that's what it'll do. It'll actually lose some of your plasticity. Plasticity is a word about the brain. You used to say once your brain's in, it's locked in, it can't really do anything. Now they're saying it's a little more plastic than we think. It can make new maybe not new neurons, but it can make new trails and new connections. And so that's what we want. Well, that is reduced if you have high sugar and low omega-3s. Well, that's at least half of America right there, right? Especially last week. So avoid MSG and aspartame. That can kill brain cells. There's a book called The Neurobiologist, Russell Blaylock, Excitotoxins, the taste that kills. I should have that where I can show it up. And that's what he says. He's the one that came out with that. If you're low in some of these antioxidant nutrients, specifically zinc and magnesium, if you have enough zinc and magnesium in your brain and you get some of these MSG and aspartame, your brain can kind of fight it off. Yeah. And if you, somebody in the back actually took a little swig of a Diet Coke, that's good. Which has the aspartame in it, that's good. Because we do it to ourselves here.
And a lot of people don't know that like Crystal Light and all that has it in it too. They need to check the label.
Yeah, exactly. Check
especially
your labels
with the
foods.
Flavored water.
Check your labels on that. A lot of stuff that tastes good has some of these markers in here to make them taste better. So you have them. Just that's what they are. But his book, I should have noted him in here. Russell Blaylock, Excitotoxins, the taste that kills. He shows that if you're low in zinc and magnesium, and you get some of this stuff in there, it kills the brain cells, whether it's a little or a lot. And if you have enough of these things here, a lot of times it can fight off and hold off. And then the last little point I want to make, because we're talking about this, we're talking about checking this omega-3 to 6 ratio, and if you're low, you want to take basically fish oil to pump things up, and also increase your diet of that. But if you take just a fish oil alone, especially high dose stuff like that, you can actually make a little oxidation, and we don't want to do that. So what do? You have to take a little antioxidant if you're going to be taking fish oils. Some of the stuff have it in there. You have 50 IUs of vitamin E or something like that. So you just want to make sure you're not taking fish oils just by themselves out of the bottle all the time. Make sure you're taking some antioxidants to go along with it. There's a study that shows that you can actually promote little carcinogenic stuff, and we don't want to do that. So take your fish oil if you need it, but also make sure you take a little antioxidants. Usually if you're taking this, you're already taking a couple other things anyway. And so that kind of ends my little presentation. Check your levels, see what they're at, get healthy. That's what we're here for. We're here to help you. Any questions about anything here?
No, I'd like to be checked though.
Okay, gotcha. That's usually we get it. Yeah. And by the way, and what we're going to end this, I'll kind of step in front of this thing here. When I learned about this, it was 2014, 2015, and I take fish oil every day, and I'm thinking, hey, I'll let me see how good mine is, right? I'm the doc. I tell people what to do. I take fish oil every day, and my ratio was I think 6.2, 6.3 or something like that. So mine was a little high. I'm thinking, if I'm the one telling people to do it, and I'm taking it every day, I need to up my dose of stuff. And so the next year I took fish oil. I didn't check it for a year, but when I checked it again, it was like 5.1 to 1. So, and now I had to take a higher dose. So that's where we're at. And so we want to make this world a healthier place. Thanks for watching online if you're doing it, or if you're watching it again. And we'll see y'all